Welcome to Business Connection. I'm Liz Spencer. We have a wonderful guest in studio. It's Dr. Lawrence Kakmar. He's the medical director for the Center for Primary Care and Sports Medicine. Welcome. Dr. Kakmar, tell me a little bit about your practice, primary care and sports medicine. I think that's a great combination.
It is. It's very tied together when you are dealing with athletes or actually dealing with patients that have medical problems.
How'd you come up with this idea? What's your background?
Well, in my youth, I was a competitive athlete, and I spent many of my years trying to patch myself up and keep myself healthy. But in the process of doing this, I also had this dream of medicine and being a physician. And, I did my medical school, and at the very end of my medical schooling, I kind of learned about this primary care sports medicine. And I moved on to my residency, and as a resident, I realized that incorporating additional fellowship training with sports medicine would tie in with my love of medicine.
So you did a residency in family medicine and then a specialty in sports medicine?
Correct. I did a residency training in family medicine. I did a fellowship in sports medicine. I am currently board certified in both family medicine and sports medicine.
You're a busy guy. That's a lot of stuff to know.
It's a lot, and some people say, how can you do both? But it kind of comes natural because it's what I've done most of my life, is trying to be active and healthy and take care of injuries. So it's kind of nature what I do, and I got the training to go along with it, and 18 years of experience of doing it. So, how
does, having been an athlete and an athlete yourself, how does that help you and help you help the patient?
I don't always like saying this, but it kind of gives me an edge over other physicians that maybe aren't athletes. It's easy to tell a runner, it's easy to tell a racquetball player just to stop playing if you're hurt, but as an athlete, there's a whole persona, there's a whole mindset that goes along with this, where you're taking away a portion of that person if you tell them, don't run or don't play the sport that you love. So it gives me an understanding of an athlete and how best to treat an athlete. By trying to keep them safe and healthy, but keep them going and keep them complete as a person. So.
It is. There's something about, I'm a runner myself, and if you told me I couldn't run, that would take something away from me. It would upset me.
Yes. I see a lot of runners. I have a runner that he's passionate about running, but he came up with a back injury, and he was someone that this back injury would not go away. But by working with him and getting him to a cross-training program and getting him to run just once a week as opposed to 6 times a week, he was so happy. He was able to do what he loves, but also stay healthy on the other days and keep him just mentally sound with who he is and what he does. So.
That's awesome. Tell me a little bit about your practice. How does it work? Tell me about your team.
Yeah, I'm a solo physician, but I have a team of medical professionals that work with me. I have office staff, I have nurses, I have x-ray techs, laboratory people, physical therapy, nurse practitioners, and we work as a team to address individual patients and also athletes themselves. So,
tell me a little bit about who your patients are. Who do you see?
It spans all ages, and it spans all branches of sports. I can deal with little children. I can deal with adolescent athletes, high school, collegiate, professional. And as far as sports goes, it goes from dancers, runners, basketball players, football players, any odd sport you could think of. I've probably seen it.
Ping pong. I'm just kidding.
Absolutely.
Absolutely.
I had a professional bowler that traveled the bowling network, the bowling circuit, and he had a bad wrist. So even then, I wouldn't think I'd be seeing a bowler for an injury like that.
Well, I think that the combination works well because often does an athlete come in with one thing but also has another problem that they can share? Why does that work so well?
Well, that's the two specialties I've chosen. That's why it's so unique, is that one complements the other. If I see someone for an injury, if something else comes up, say if they have a sore ankle but then they get a rash, they can come back and they know me, they're comfortable with me, they don't have to meet a new physician. If someone is seeing me for diabetes or asthma and they want to do some sort of weekend warrior thing, or they want to start training for a marathon that's coming up next month, they can come to me for a musculoskeletal problem if they come up injured. The two are, I really find the two are hard to separate, actually.
Well, and you had mentioned something off camera that 90% of athletic injuries are non-surgical.
Correct. I'll do minor office procedures, but really anything major, that is kind of unique about my training. Anything that is a major injury that requires surgery, I'm trained to recognize that, and I'll get you to the appropriate people. But really, when it comes to most injuries, about 90% of them are not surgically are necessary or indicated. And I'm able to kind of assess the injury with my training. I think I'm a little bit better of a diagnostician than most. And so you can find out the specific injury. When you know the specific problem, you can actually treat it better that way.
And what role does physical therapy play in your practice there?
It's very important. Though I would say they play the biggest part in getting a lot of the people back on the road and back to what they're doing. We've talked a little bit earlier that with therapy, it could be your hip may be hurting, but it may be a back or a knee problem that has to be addressed. So what I do kind of goes hand in hand with physical therapy, that if I give them a good diagnosis of what the problem is, the therapist can better treat that with the diagnosis of what's going on.
What do you like most about your practice and what you do?
I wake up every day feeling lucky I get to go to work. It's kind of living, it's a passion of mine. Whether it's, I love medicine and I love the sports side of it, the musculoskeletal parts of it, and being able to help people and especially help people when no one else could help them.
That's awesome. Thanks for stopping by and sharing a little bit about what you do and how you do it. We wish you a lot of luck.
Thank you.
We'll be right back with more Business Connections. Stay tuned.